Right off the bat, if you're a Western-trained therapist or, just someone really fascinated by human psychology, you probably rely pretty heavily on standard diagnostic manuals. It's totally normal to just assume psychological diagnosis is a universal language, right? But what if the very foundation of how we define a healthy mind is completely foreign to the person sitting across from you? In this explainer, we're going to bridge a massive divide. We'll be comparing how Western and African perspectives define, diagnose, and treat abnormal behavior. So let's just dive right into it.
Here's a quick look at our roadmap. We're going to unpack etic versus emic perspectives, look at individual versus communal well-being, contrast the DSM V with holistic healing, talk about the impact of colonialism, and then wrap the whole thing up with a practical guide for clinicians.
Okay, Section 1. Idic versus emic perspectives. Basically, the foundation of how we even begin to understand patients.
To really help people, we have to look at how we're viewing them in the first place. You've got the etic approach, which is essentially the perspective of an outsider looking in. It's trying to find these broad, universal truths that apply to literally every human being on the planet, regardless of culture. Then, on the flip side, you have the emic approach. This is the insider's perspective. It focuses heavily on culture-specific distinctions that really only carry weight within a particular society. Now, modern cross-cultural psychology definitely advocates for a blended approach, but traditionally, Western medicine leans hard on the etic side. It kind of just assumes its rules apply everywhere.
Think about the standard Western worldview for a second. It typically defines abnormality simply as behavior that falls outside societal norms, or maybe it reflects some sort of internal mental weakness. It is hyper-focused on the isolated individual's capacity to survive and function in society. Basically, if you don't fit the mold, you're labeled abnormal. But, as you'll see, that definition is far from universal.
And that brings us to Section 2, which is this massive worldview divide between individual and communal well-being. There's this concept that just brilliantly illustrates the African worldview, motho ke motho ka batho. It translates to, a person is a person through other people. Or even more simply, I am because we are. In this philosophy, there's no such thing as an isolated individual. Your existence is entirely tethered to your community. You simply can't isolate a patient's mind from their environment, their family, or their social ties. The priority is always interpersonal relations. The community itself is responsible for the well-being of its members.
And its interconnectedness actually extends way beyond the living. In African cosmology, you have Badimo, or Amadlozi, the ancestors. They are considered the living spirits of the deceased. The source material describes them beautifully. It's like they're the roots of a living tree, and those of us on the earthly plane are the branches attached to those roots. The ancestors act as intermediaries and protectors. So the crucial takeaway here is that any detachment from those roots, any disharmony with the ancestors, is believed to cause profound spiritual and mental illness.
When you put these two perspectives side by side, the contrast is honestly staggering. Western well-being is all about fixing the gears inside one isolated person's head. African well-being, though, defines dysfunction as a state of collective imbalance. It encompasses physical, spiritual, and social dimensions all at once. If there's disharmony with family or nature or the spiritual realm, that is what makes someone ill. It's an external disruption, not just some internal malfunction.
Moving into Section 3, DSM V versus holistic healing, let's look at how these worldviews actually clash in a clinical setting.
Historically, the multi-axial DSM system has been the dominant classification scheme pretty much everywhere. It evaluates clinical disorders, personality, medical conditions, environmental problems, but traditionally, it relied entirely on symptom-based individual evaluations. Because it was built on that universalistic, outsider etic perspective we talked about earlier, it fundamentally struggled to capture any real cultural nuance.
Now, to be fair, the modern DSM-5 does make a concerted effort to include cultural concepts of distress. It tries to acknowledge cross-cultural variations. But, according to our sources, it still falls short. Why? Well, because it ultimately still views culture exclusively through a Western lens. It gives culture this restricted little position, treating it like an accessory to the diagnosis rather than the core framework. So fundamentally, it remains an outsider's perspective.
In stark contrast, traditional African diagnosis views illness as something often caused by external forces totally out of a person's control. It signifies a breakdown in social or spiritual mechanisms, like maybe you offended a neighbor or neglected an important cultural ritual. And this is a total paradigm shift. Mental illness isn't just pathology that needs to be eradicated. It's actually a carrier of messages that elders or healers need to decode. It's basically a symptom of a much larger communal disharmony.
Okay, Section 4.
To really understand a modern patient from an African background, we absolutely have to talk about colonialism and what's called the anti-self attitude.
There was a massive historical disruption here. Back in the pre-colonial era, healing relied deeply on nature. Forests and rivers were literally medicinal. Then, the colonial era brought complete devastation. The loss of land totally severed that connection to nature, and an incredibly individualistic lifestyle was forcibly imposed. So today, in the modern era, the sources point out that many individuals exist in a state of deep dissonance. They're grappling with cultural misorientation and energy imbalances precisely because their traditional ways of life were torn apart.
This profound historical wound gave rise to a concept that scholar Naim Akbar calls the anti-self attitude. According to the texts, this happens when dehumanized individuals adopt a materialistic value system just to gain approval from a dominant culture. Because their traditional community ties were fractured, validation suddenly becomes tied to external possessions. And unfortunately, this often leads straight to self-destructive behaviors, things like substance abuse, as a way to cope with the sheer frustration of existing in an oppressive society. Now, as therapists, there are some major misconceptions we need to avoid for sure. First, that myth of angry ancestors maliciously punishing their kin, that's a colonial distortion. Ancestors are protective intermediaries. Second, we have to stop treating only the surface symptoms. African cosmology demands that we find and heal the environmental source of the illness. And finally, practitioners need to be really careful not to fall for the modern commercialization of indigenous healing, which honestly just exploits these ancient belief systems.
All right, final section, Section 5. Let's take all of this theory and turn it into a practical guide for bridging the cultural gap in your practice.
I want you to imagine this scenario. A client sits down in your office and firmly tells you that their mental problems are due to spirit possession. How do you treat them? Do you just immediately whip out a prescription pad for psychosis? Or do you take a step back and recognize the cultural context? It's a question that really challenges your standard operating procedure.
A good way to answer that is to look at how distress actually presents itself. A Western patient is probably going to express direct psychological guilt, or they'll talk about emotional trauma. But research shows that African clients frequently present with somatic complaints, physical things like severe headaches or body aches, to communicate something like depression. Why? Because opening up about deep-seated emotional trauma to a complete outsider leaves you incredibly vulnerable. Presenting a physical complaint connects to the safer, outer self.
To bridge this gap, we need to talk about the concept of ukava, or hu'utla. This loosely translates to hear or feel. In African cosmology, a healthy person is having a constant, ongoing conversation with their psyche or soul. If someone is ill, that connection is blocked. Healing isn't about slapping a Band-Aid on a symptom, it's the diagnostic activity of genuinely taking time to listen to oneself and realigning the physical body back into harmony with the soul.
So how do you actually practice ukuvala? Well, first, you have to move way beyond basic Western empathy and achieve what's called ukuvalana, which is a deeply reciprocal understanding. Second, you have to operate with profound humility. You literally have to abandon that hierarchical expert role that Western medicine loves so much. Third, become umtu. Become that person by letting the patient's worldview completely engulf you. And fourth, do not do it alone. Welcome their family and even traditional rituals right into the healing process.
As we bring this all together, there's a quote from the source material that sums it up perfectly. It says, "All cultures experience psychopathology, but culture acts as a filter not only when we perceive things, but also when we are thinking about events." You have to remember that culture is a two-way filter. It completely shapes how your patient presents their pain, and it absolutely dictates how you, the therapist, interpret it.
So I'll leave you with this one thought. In your very next session, are you going to merely diagnose the isolated symptoms of an individual using an outsider's manual? Or are you going to take the time to listen, step out of the expert role, and help heal the harmony of a community? Something to think about. Thanks for exploring this topic with me in today's Explainer. Keep learning, and we'll see you next time.